Well, ER nurses, doctors, and staff at Weiss Memorial Hospital say the emergency room will be shutting down in the next hour.
And federal officials are pulling Medicare and Medicaid funding tomorrow after years of safety and staffing violations. Darius Johnson is live outside of that hospital in Uptown right now. And Darius, those doctors, nurses, and staff just announced a rally set for this afternoon, and they will push for the ER to stay open.
Hey there, ladies. Good morning to you both. Yes, that rally is set for 1 o'clock this morning, and 1 o'clock this afternoon, rather. They are calling for the hospital to remain open. They are hoping that the ER, the emergency room, does not shut down at this point. However, it seems that that is inevitable at this point. Now that the doctors, nurses, and staffers all say that they've been told that this will take place at 7 o'clock this morning. And you know what? Actually, right now, we have a state representative who will be coming to speak with us. He's going to be present at that rally later on this afternoon. He's going to step in right now. We're getting him mic'd up. This is Illinois State Rep Hoan Huynh. Good morning, Hoan. How are you?
I'm doing well. How are you doing today?
Good, good. Sorry, we are just now getting you on air, and
yes.
Thank you all for bearing with us. Hoan, thank you for joining us this morning, and thank you for being willing to speak with us about this. Talk to us about this impact with this hospital, this emergency room set to close within an hour.
Yeah, this is going to be a huge detrimental impact to the community right now. I mean, this hospital has served this community for decades, since the 1950s. It served low-income immigrants, refugees, communities of color. I myself am also a patient at this hospital as well for my services, and it's going to be very, very difficult for all of us in this kind of environment. And we know this is what's happening. This is just the very beginning of what's going to happen across this country with the cuts to Medicare across the board, right? I mean, we're going to see over 10 million people lose their coverage because of the big, ugly bill that's happened under this president and this administration. And so that's something that's going to be very difficult for us to deal with as we're fighting to keep this hospital alive.
Talk to us a little bit, because I know there has been a little bit of back and forth, and there also have been some reports that have come out talking about the actual care of the facility, the short staffing, and also the patient care as well, and the safety of those patients when they are inside this hospital, even leading to recent investigations from the Illinois State Department of Public Health over recent years. I believe 7 investigations. So talk to me about that. Do you think that there was a point for the hospital and the staffers and really the leadership to be able to clean a lot of this up before it got to this point where they are now stripping the hospital of those Medicaid and Medicare services, where you now have an emergency department that will be shutting down in an hour?
Yeah, absolutely. Look, make no mistake. You know, this was a failure of epic proportions. You know, it was a failure on management to make sure that they're not able to address some of the issues that occurred in this hospital when it comes to staffing ratios, when it came to the safety of its patients, when it comes to the infrastructure of this hospital. So this was a failure of management. But at the same time, this is also a failure of the federal administration as well. When it came down to it, federal CMS took away the billing of Medicare and Medicaid. This hospital is 82% Medicare and Medicaid eligible, right? I mean, that's what they bill for every single cycle. And so they need those resources in order to stay alive. And the problem that we have is when Medicare is stripped away from hospitals like these. This is a safety net hospital. It serves the most vulnerable of our neighbors and of our constituents. When a hospital is stripped of Medicare, it cannot survive. And that's what's going to happen across this country when the big ugly bill takes effect, right? And it's already taking effect across this country. And I think this is the problem where we need to make sure that healthcare is more accessible. Healthcare is a human right. And that's why I'm also running for Congress as well, to make sure that we protect healthcare, that we support our safety net hospitals, and that we expand healthcare access across the board.
All right. Thank you so much. I really appreciate it. If you just stand by with us, we're going to wrap here, and then we're going to continue our conversation off camera after. Again, as you just heard the state rep refer to the the one beautiful bill as the one ugly bill by the Trump administration currently. And just speaking to the impact, it's already being felt at other hospitals right here in the area. Many of those hospitals already seeing more ER patients, inpatient admissions, and specialty care referrals coming directly from here at Weiss Hospital. We'll join you all live once again at 7 o'clock this morning when they say those doors of the emergency room are set to close and be shut down. Sending things back to you, Dana and Jackie.
Darius, thank you so much. And I think the big question right now, Dana, as you mentioned, is what comes next for the hospital and what comes next for the residents who go to the hospital, use its services.
Yep.
All right, in just a few hours, we are expecting to hear from the CEO of Weiss's parent company, Resilience Healthcare. He's set to join state representatives LaShawn Ford and Camille Lilly at West Suburban Medical Center in Oak Park. That is the other Chicago area hospital that Resilience owns. It is not clear what they plan to discuss or how it relates to the crisis at Weiss.